Hi, Tanya from Created Health, Nutrition and Fitness. So this is part 2 of the maternal Chlormequat Chloride exposure disrupts embryonic growth and produces postnatal adverse effects. So this is a pesticide that we are finding in wheat, in all wheat products and some animal products as well. If you want to know more about the background of Chlormequat Chloride, then see part 1, but this is part 2, and we're going to break down this research paper. And just so that you are aware, this research paper that I'm referring to, you can look it up yourself. It's quite a long research paper. There's about 11 or 12 pages involved, and there's a lot of information to unpack that's really important for your health and also for your future baby's health. So this research is animal study. Just because it is unethical to do research studies on pregnant women and newborn babies. So it is rats. But the metabolic outcome of Chlormequat Chloride in rats is similar to that of humans, and it is excreted unchanged in the form of urine in both the maternal rat, the rat, which is how we would excrete it as humans as well. So it was found that the embryonic hormone GHRH was significantly elevated, but the hormone SRIF was not affected by Chlormequat Chloride. Now, these two hormones, they work together in unison. They regulate the growth hormone pulse known as GH, growth hormone. Now, GH is a key regulator for multiple metabolic processes within the body, especially during the embryonic development. So what was found was Chlormequat Chloride was creating a elevation in GH levels. So the embryonic growth was disrupted by Chlormequat Chloride. It was indicated that the embryonic head and length and total protein content were significantly increased by Chlormequat Chloride. The results showed that the head length was significantly increased by the maternal exposure of Chlormequat Chloride, and the amount that was used was 5 milligrams per kilo of body weight. Now, in regards to organs, it was revealed that the brain weight was significantly increased by Chlormequat Chloride. The significant increase in brain weight is actually in line with the elevated head size and the increased embryonic head length. Now, in regards to the body composition, it revealed a decrease in fat weight and fat percentage. Further studies were then done on glucose, lipids, and protein levels in serum. So with the glucose concentration, there was a significant decrease compared to the control group. And of course, when we're looking at research, there's always the two different groups, and one group is a controlled group and one group is a non-controlled group that gets exposed to the ingredient or the pesticide that's being researched. So the triglycerides and total cholesterol levels in serum were increased by Chlormequat Chloride compared to the control group. The total protein and albumin levels were also elevated, and the changes were more significant in the males. And this is profound, and I'll get down to that in a minute as to why that is, but very interesting that those elevated changes of protein and albumin were elevated more significantly in the males. So it was found that the offspring of maternal exposure to Chlormequat Chloride at 5 milligrams per kilo of body weight during pregnancy had a syndrome that was consistent of hyperlipidemia, hyperproteinemia, and hypoglycemia. It was found that Chlormequat Chloride not only affects the embryonic growth, but also has a further impact on postnatal health of the offspring and long-term health effects as well. So even though there was an increase in the head length, the body length and the body weight were not affected. So the embryonic head length was significantly increased, but from the crown to the rump, the length was not affected. The increased head size might be related to the increased brain weight of the infant as shown in the study. It's long been recognized that GH, growth hormone, is essential for brain development, and when you were exposed to this Chlormequat Chloride, it elevated the GH, the growth hormone, and this is why there was this disruption with brain development, because GH treatment can promote brain development in several ways. So GH increases the number and the length of dendritic spikes. It promotes the genesis of neurons in the form of astrocytes and endothelial cells. So astrocytes, they are that star-like glial cell that's found in the central nervous system, and it maintains homeostasis within the nervous system. And we are actually seeing an increase in central nervous system disorders. Those cells also support neural function, form the blood-brain barrier, and they also regulate the synaptic activity within the brain. The endothelial cells, they form a really thin single layer lining of the internal surface of all our blood vessels, and they act as a crucial barrier between blood and the surrounding tissues and the surrounding organs. Also noted that there was a hypersecretion of GHRH, and this is clinically associated with things such as gigantism and macrocephaly. Is that how you pronounce it? Where the head size is quite small. So this hormone GHRH was affected by this pesticide. And this is the consistent variations of factors of body composition that were observed. This was found that the fat weight and the fat percentage from being exposed to Chlormequat Chloride were significantly decreased. Now, the decreased fat percentage and the body composition was accompanied by the elevation of triglycerides and total cholesterol levels, and we're actually seeing a lot of imbalances with triglycerides today. It has long been recognized that GH, that growth hormone, can stimulate the metabolic process of breaking down the stored triglycerides in the adipose tissue and increasing the concentration of free fatty acids and glycerol within blood circulation. So when we break down that stored triglyceride, it just releases those free fatty acids into the bloodstream. Now, that increased free fatty acids and glycerol, they get transferred to organs such as the liver and the intestines, and then from there they get converted into triglycerides, and because of that then leads to a elevation of triglycerides. So free fatty acids can only be transported in the blood in conjunction with albumin, and albumin is the most abundant protein in human blood plasma. So the free fatty acids can only be transported in blood circulation in conjunction with albumin in the serum. So the increased release of free fatty acids requires an increased synthesis of albumin as the carrier for transportation. Now this isn't a problem because when we have elevated GH, that growth hormone, this also increases the production of albumin. Remember I said just before there was an increase of protein and albumin that was caused. So this is consistent that the albumin and the total protein levels in serum were elevated as indicated in this study. So this study actually revealed that that is what was happening. Now the elevated GH, the growth hormone, can reduce glucose concentration in serum by stimulating the process of gluconeogenesis in the liver. So that hypoglycemia was due to the glucogenesis induced by elevated GH, growth hormone levels, in different stages within the embryonic growth and the development. So not only was GH, growth hormone, disrupted by this pesticide, but also TSH, which regulates the embryonic thyroid hormone, which affects the carbohydrates and lipid metabolism. It's also reported that testosterone and estrogen have multiple interactions with GH and IGF-1 axis. Now there's a lot of talk at the moment about this IGF-1 drug that's around for weight loss at the moment. So there is this interaction that happens with GH, growth hormone, and IGF-1 on that axis, and it regulates the growth and the development during puberty. But it happens also during the embryo being developed, and then goes on up to puberty. It influences that as well. So therefore those symptoms of hyperproteinemia, hyperlipidemia, and hypoglycemia revealed in this study might be a combined result caused by various disrupted regulators at different stages of the embryogenesis. But what we have found with the testosterone, which I really want to also bring home, is this impacts male fertility, and it does this by decreasing the mobility of the sperm. So the sperm mobility, the movement of the sperm, is decreased, which increases male infertility. So there is so much going on with this pesticide that is found in wheat. So if you want to do a nutritional consult with me, I would love to support and help you in every area of your life. I really love helping couples that are looking at starting a family, because your nutritional intake is so important, not only for your fertility, not only for the development of your baby, but your ability to fall pregnant, your ability to carry that pregnancy through, and to create healthy babies. But all of our nutrition at every stage of life is very, very important. I'm Tanya from Created Health, Nutrition and Fitness. Remember, at the end of the day, not only is your health your wealth, but your health is also your future baby's wealth.